for joining us for another Facebook Live. Today's interview is brought to you by Kohl's Cares and our Healthy Lifestyle Center, both of which are committed to the health and wellness of families. Today, Dr. Trey Wickham, Associate Professor and one of the directors here at Shore's Healthy Lifestyle Center, is with us to discuss pediatric obesity. Dr. Wickham specializes in endocrinology and metabolism, weight management, and adolescent bariatric surgery, and he helps children, adolescents, and their families develop habits that can help them live healthy lives now and into adulthood. If you have any questions along the way, please leave them in the comments and we'll try to get them answered within the next week. Thanks for being here, Dr.
Oh, you're welcome. Yeah, my pleasure.
Can you start by defining pediatric obesity for us?
Yeah, well, how we kind of define weight in kids typically is by something called body mass index. So this is a number that can be calculated based on a child's height and weight, and then you put it into a formula and it gives you the body mass index. And then, like many things for the pediatric population, what's a healthy BMI changes based on what age the child is and whether it's a boy or girl. So how we define healthy weight is a BMI that's between the 5th and up to the 85th percentile for that child's age and sex. Overweight would be when their BMI is greater than the 85th percentile. And then we would say a child has obesity or their BMI is in that category when their BMI is greater than or equal to the 95th percentile for age and sex.
Okay. And so pediatricians are generally tracking this at their well visits.
Yeah, the recommendations for the American Academy of Pediatrics is just like you're looking at height and weight on growth charts annually, that the pediatric provider is also looking at BMI percentile.
Okay. And why is it that overweight and obesity in children is on the rise?
Yeah, so certainly we know that over the past 30 to 40 years, the rates of obesity in children have increased substantially. I like to describe the obesity epidemic, or I think it's best described as kind of a perfect storm. Many times people have tried to reduce obesity, including that in kids, to just personal habits that, if people just made healthier decisions as far as eating choices and were more active, it would cure this or taking care of the obesity epidemic. But we know that weight is so much more complicated than that. There's certainly a strong genetic component. There's also a lot of factors in our environment and how that's built that kind of contribute to weight gain. So, this is a complex problem.
So what are some of the health consequences of pediatric obesity?
Yeah, so one of the things that we know is that youth with obesity are at higher risk than their healthy weight counterparts of developing health conditions related to weight. And unfortunately, it doesn't have to wait just to adulthood before you start to see these. We can see kids that have obesity are at increased risk of development of type 2 diabetes, high blood pressure, problems with their liver, arthritis. And one of the impacts I think that's underappreciated is just the impact that having obesity as a child, the impact on quality of life and kind of their behavioral or their emotional well-being.
No, that's a really good point. So talking about emotions, weight can be a sensitive topic no matter what our age. What should a parent do and then maybe not do if they have concerns about a child's weight?
Yeah, so I think it's really important, to help parents think about how to talk to their child about weight and health behaviors. And most of the time, if it's coming initially, the parent initiating the conversation, we really like to encourage parents to focus on healthy behaviors as opposed to weight, because weight is just one context of kind of health. And so, again, putting it in context of choices that people are making as far as eating habits and exercise habits. I'll say if a parent has concerns about weight, one of the things we always encourage them to do, like we talked about, is check with the child's primary care provider to have that discussion. Things I would encourage parents not to do or to consider them to be thoughtful about how they talk about their own body weight and other people's body weight, because I think our kids pick up on a lot of that. And just making sure that parents are talking about their own bodies, other people's bodies, in ways that are that are positive. When a child does bring up a concern about their weight to their parent, though, I think it's also important that the parent feel like it's okay to talk about that with it, because many times kids might be concerned about these things, and you want to be able to initiate those conversations.
Yeah, good point. So can you talk about some examples of healthy habits that can help combat obesity? Maybe some suggestions we can offer.
Well, I think an important thing to kind of highlight within this context, right, is that making healthy eating habits, being physically active, is important for individuals regardless of what their body weight is. And so if we think about things that really I think can have a big impact on promoting health and preventing obesity, I might pick I'll give you a couple examples. So I think one thing is thinking about sugared beverage intake. So these are things like sodas, sports drinks, juices, sweet tea. And we know that there is a clear correlation that as individuals drink more of those, they are at increased risk of gaining weight. And all of them have relatively limited or no health benefits. And so kind of focusing on limiting those things. I think another thing would be healthy snacking. And so making sure that within the family environment, living environment, there's healthy snacks to choose from. A big thing on that, is choosing or helping promote that when you do eat a snack, that it's in a scenario or a setting where you can really enjoy the snack. So turning the TV off and enjoying the snack. And kind of related to that, I think a really important habit would be family meals. So trying to, I know we all have busy lives, but as much as possible, families sitting down to have meals together and turning off the television or other sort of distracting things. There are so much research data about the benefit of family meals together. We know that it decreases rates of obesity for kids, but is also associated, having meals together as a family, associated with improved parent-child relationships, better school performance, lower rates of substance abuse. So eat together as a family as you can. The two other things I would add as far as healthy habits is increasing physical activity. So, it's recommended that children get an hour of exercise or active play daily, and as part of that, limiting screen time. So,
so you talked a little bit about the, family meals together. What other sort of habits or things can families do together to build a healthier lifestyle?
One of the things we know about health behaviors for the pediatric population is that the kids are going to be most successful when families do it together. So kind of engaging on that journey together, working on healthier eating habits and being physical, improving physical activity. A couple of things I would kind of suggest as part of that. One is that it doesn't work well when a single individual in the family kind of gets singled out, that they're going to be, that other folks can have dessert, but this particular, kind of child, I can't. As we're making changes with the family, I think another important thing is the importance of role modeling. So, again, there's a lot of good research data that we have that children and even teenagers are going to model their health habits on what they see significant adults in their lives doing. We often talk about, particularly with teenagers, that they're going to do the exact opposite of what we say. Well, that might be the case, but again, we still have strong evidence that suggests they're gonna model their habits as far as eating behaviors and physical activity based on what they see their parents doing. So if I could share one other thing we kind of think about with families, and that's kind of helping parents think about reducing kind of conflict over some of these changes. And so we at the Healthy Lifestyle Center really try to help parents think about how they can improve or how enhance their skills in something called authoritative parenting, and we like to describe that as limits with love. And so, kids and families need structure, but there also needs to be a little bit of flexibility within that. And so, coming down as a family and saying, hey, we never have dessert, probably isn't a realistic or sustainable option, but saying, hey, as a family, we're going to limit dessert to once or twice a week, and then having the entire family help kind of make as far as that, make as far as that choices, I think is going to be the most beneficial kind of way to go to sustain change over the long term.
Yeah, that makes sense. So if a child has been diagnosed with obesity, at what point would you recommend care, visiting a specialty center for more robust care?
So the American Academy of Pediatrics has recommended kind of a staged treatment for obesity in children, and it emphasizes really the importance of starting in the at the child's medical home. And so the first stop typically is always with their primary care provider. And one of the things I'd highlight that we haven't talked about, sometimes I think parents, because they're concerned and want to make changes, will try to institute kind of a diet at home. And we really, particularly within the pediatric population, would encourage parents before they start any specific diet that they really talk to a healthcare provider about what's safe and appropriate for their child and actually going to be kind of sustainable kind of over the long term. But for kids that have more severe obesity, or if they've been working with their primary care provider and they haven't experienced the changes in weight that they need to, it can be appropriate to see a specialty center that focuses on kind of healthy lifestyles and weight with that. And that might be participating in a program that's a little bit more structured, so that has nutritionist and a health psychologist and even exercise specialist that can help the family come up with a little bit more structured program for weight loss. Occasionally there are kids that have more severe obesity and might have already developed some of those health conditions we talked about related to weight. And for those it might be appropriate to see a specialist kind of in the area. At times we'll talk about, in addition to those lifestyle changes, instituting medications or even weight loss surgery in children that have severe obesity and have been engaged in those lifestyle changes but haven't yet had significant weight loss that they need to improve their health.
Okay, so perfect segue. When is weight loss surgery appropriate in the pediatric population?
So this is an area where we've been learning a lot, and I would say have gotten much more data about kind of the role of weight loss surgery in adolescents, both its safety and its long-term outcomes. Certainly weight loss surgery is not for everyone, but the recommendations, because we have data that show that in children with severe obesity, particularly those that have other weight-related conditions, that it could be part of a comprehensive and effective treatment. It is something that should be kind of offered to families. The guideline specifically that we typically think of is a child that has a body mass index that's over 35 and has other health conditions, or over 40. It might be appropriate to talk about kind of weight loss surgery. Okay. If I could just share one thing, it's kind of how we think about weight loss surgery, and I know we had done another Facebook Live about this, but I think it's helpful just to think about it's not just weight loss surgery, it's all in that context of comprehensive care. And our team loves to describe weight loss surgery as a magnifying tool. It's not something that's just passively done to a person and they magically lose weight, but it's a tool that adolescent or child then has, where we like to describe it as a magnifying glass. So it takes those lifestyle changes, the eating habits and exercise habits that they're working on, and magnifies the impacts that they get from those changes on their health.
I like that.
Yeah, it's a good analogy. I think that helps families kind of understand that.
Right, the whole package of. So, speaking of whole package, you've talked a little bit about parts and pieces of what your team does here. Yeah. Can you put that together for us and explain what the Healthy Lifestyle Center is and what the services are that are available?
Yeah, so the Healthy Lifestyle Center at Children's Hospital of Richmond is really an extension of the Center of Endocrinology and Metabolism. And our team includes not only medical providers that specialize in pediatric obesity, but again, registered dietitians, health psychologists or behavior coaches, and exercise physiologists. And our goal is actually to partner and help families and to come up with a treatment plan that's right for them. We are the region's kind of most comprehensive and tertiary care center, so we do, for those children where it might be appropriate to be part of their care, have expertise in using weight loss medicines, as well as a team that's been designated as a center of excellence for adolescent surgery, weight loss surgery. Yeah.
Great. Well, thank you. Is there anything that we've missed or that you would touch on that, Yeah,
I think we summarized a lot of stuff. I mean, I think, again, this is all about healthy changes that can last a lifetime, and I can't underemphasize the importance of families doing this together. You know, none of us have perfect diets or perfect exercise routines, and even small changes over a lifetime can add up.
Great. Thank you very much.
You're welcome.
Thanks for joining us.